Inborn errors in metabolism, fatty acid oxidation disorder, Module 2, Lecture 5 in the genetic series. The clinical symptoms of fatty acid disorders are hypoketosis. In the case of diabetes, the body is unable to transport glucose into the cell, either because of insulin insufficiency, because of pancreatic islet destruction such as DM1, or abnormal response between insulin receptors and glucose transport at the cell membrane, as in DM2, or non-insulin dependent diabetes, or NIDDM. When the cell does not have glucose, it obtains energy from breaking down fats. The end product of fat breakdown can be used to synthesize ketones. There should always be ketones when glucose is not readily available to the cell. So it is normal in somebody that doesn't have sugar to the cell to have ketones. In disorders of fatty acid oxidation, the individuals are unable to break down fats during times of stress and energy. Therefore, their glucose inside, there's no energy sources inside the cell. In the case of diabetes, again, you should be breaking down ketones to make energy, because even though there's a lot of glucose on the outside of the cell, there's not a lot on the inside of the cell. But always when there's hypoglycemia, there should be ketosis. Now, this is a more simplistic representation of fatty acid oxidation than some of the lectures, so I'm not going to go through all the enzymes involved, but basically, triglycerides we store and we bring to the cells to break down to be used for energy. And so when these triglycerides are converted to fatty acids and attached to acyl-CoAs, and in that way they can get to the outer mitochondrial membrane. They're then shuttled into the inner mitochondrial membrane on something called carnitine, and carnitine is a vitamin that allows them to transport to the inner mitochondrial membrane. There's a process of 7 different steps where they go from C16 to 14, 14 to 12, 12 to 10, 10 to 8, 8 to 6, 6 to 4, and then 4 to 2. And each of these 2 carbon pieces are fed into the citric acid cycle, and this system is known as beta oxidation. And this is how we get energy. Disorders of fatty acid oxidation, each one of those steps from 16 to 14, 14 to 12, so on and so forth, require a different enzyme. Long-chain fatty acid is between 16 and 14. Medium chain is between 6 and 8. And short chain is really the last step between 4 and 2. Some people don't even believe that MCAD or short chain is really even a disorder of fatty acid oxidation. But that's still up for debate. But when we look at the acyl species, what we should see is something like this. We see equal amounts of 2, 4, 6, 8, so on and so forth. When we have a patient with a disorder of fatty acid oxidation, for instance, when there's a problem with a breakdown from 8 to 6, we see a lot of 6 and very little, a lot of 8 or octyl carnitine and very little 6, 4, 2. And again, here you see like equal amounts of those. So when we talk about looking at acyl-carnitines by mass spec, this is what we're talking about. Medium chain acyl-Coenzyme A dehydrogenase deficiency, or MCAD, is the problem with that enzyme that breaks from 8 to 6. This is the most common of the disorders of fatty acid oxidation, occurring about 1 in 6,000 individuals. The enzyme involved, this enzyme is involved in mitochondrial fatty beta oxidation, and symptoms usually occur after prolonged fasting. Hypoketotic hypoglycemia, or also known as rye-like illness. So again, you're hypoglycemic. When you're hypoglycemic, when your cells are low in glucose, you should be breaking down fats. And so when you're hypoglycemic, you should be ketotic. When you're not, that's a problem. Organic acids, which we talked about before when we were talking about metabolic diseases, and acyl-carnitines will show an increase in what's called the C6 to C10 dicarboxylics, and I just described what those were in the previous. It's actually believed that 2 to 3% of SIDS, or sudden infant death, result from MCAD. They actually went to the newborn screen cards in about 3 to 4 states and looked at babies that died of an unknown cause. And they found that 2 to 3% of them actually had this fatty acid oxidation disorder. What happens is the baby maybe has a mild viral illness, a little bit of a temperature, they haven't eaten because they're not hungry, and they go to bed at night and their temperature and their glucose drops. It drops from 90 to 80 to 70 to 60, and they have no way to get any energy back. And so when it gets around 60, the respiratory center stops and they don't wake up, unfortunately. This is actually, all these fatty acid oxidation disorders are now tested on that newborn screen. So usual presentation of disorders of fatty acid oxidation, as I said, episodic illness with hypoglycemia, usually between 3 months and 2 years of age. Usually following fasting of 12 or more hours with an incurrent viral infection. Usually, this increases metabolic needs. Acute episodes often start with vomiting, lethargy, or even seizures. The brain seizes when it doesn't have sugar. It gets really mad. And it can progress to coma rapidly. And again, with an infant, all this could happen before you even knew it happened. MCAD is inherited in autosomal recessive fashion. The gene is located on chromosome 1. And for an individual to be affected, they need to have 2 non-functional copies of the ACADM gene that codes for that enzyme. LCHAD, or long-chain fatty acid, is the elevation of C14. This is usually known on acyl-carnitine, or shown on acyl-carnitine studies. Features include, in addition to what I was talking about, hypoketosis, there's low muscle tone and cardiomyopathy. So it's a more severe fatty acid oxidation disorder and earlier symptoms and more severe symptoms. SCAD, as I said a little bit earlier, is the last step going from C4 to C2. Actually, C4 to 2 copies of the C2s. And there's really no hypoglycemia, no real risk of SIDS. It may not be a metabolic problem, but it's still, talked about. When we have a baby with an abnormal newborn screen, we still have them come in to be monitored. So a 3-month-old presents to the emergency room, the parents having difficulty arousing the baby. He had a viral illness and poor oral feeding for the past 2 days. In the ER, the baby was noted to have a glucose of 52. The urine dip was negative for ketones. The most likely cause of this lethargy is urea cycle. Well, you probably don't have enough information here to say that. And maple syrup urine disease, galactosemia, MCAD, or PKU. And the correct answer is MCAD. And this concludes this module.